Hey everyone, this is Dr. Dane with your Into Health video tip of the week, and these are 2-minute videos designed to improve the quality of your health, thereby improving the quality of your life. And today we're going to continue our discussion of forward head posture and loss of normal cervical lordosis or curve. In the spine, you have 3 curves from the side. From the front, spine should be straight as an arrow, but from the side, we have 3 curves in the spine. That is extremely important because it's these curves that help to decompress the spine, deload the spine, absorb shock. So a spine with 3 curves absorbs 10 times more compression than a spine without curves. So we want to have those curves in the spine. And the curve that we typically lose is the curve in the neck because we're looking down at screens all day long. And our spine tends to wind up in the position that we put it in the most. So when our head is in flexion, we tend to lose that curve. When we look up, we promote the curve. When we look down, we lose the curve in our neck. So one of the things that we do in our office is we give people a lot of extension exercises, like I went over last time. But another device that we use is called a Dentarol. And it's shaped like this, and the spine, you lay on this. And when you lay on this, the head acts as a weight to traction the spine into extension. So you're literally laying on this. This acts like a fulcrum. It's placed at the lower part of your neck to put your neck into extension to promote that healthy cervical curve. And again, when we look at people's x-rays, and you'll see, I'm going to put up an x-ray here where there should be a nice forward curve, and you'll see this patient is losing the normal curve in their neck. Is the person who sits at a desk and at a computer and has done that for years and decades. So when you're considering chiropractic care, you always want to consider using tools like this outside of the office. I always tell my patients there's things that I can do for you that you can't do in office, like adjust you. You can't adjust yourself. But there are a lot of things that you can do outside of the office to help to promote normal alignment, take the stress. Again, when you're losing that normal curve and your head's coming forward, it's not only creating a lot of damage in the neck, and we see common problems like headaches, neck pain, shoulder issues, but it's causing a lot of traction on the spinal cord. So if this is the curve you should have in your neck, when I straighten that out or reverse it the other way, you'll see that rubber band in the back stretch because it has to elongate to accommodate that position. So really, you want to know whether you have a good, healthy curve in the neck. And if not, it's something you definitely want to address. So this is Dr. Dane with your Into Health video tip of the week. Please share these videos, and we'll talk to you next week.